Hi guys, so today we'll talk about trachea, and trachea is a very important topic for your exam point of view, be it a short question on trachea or a long answer on the various relations of the trachea. So we'll start with today's topic. Now, trachea is said that it is a fibroelastic cartilaginous tube. So it is a flexible fibroelastic cartilaginous tube. So it is a flexible fibroelastic cartilaginous tube which is extending from the cricoid cartilage. So it's extending from the lower border of the cricoid cartilage at the level of the C6 vertebra. And it is going to go in the living subjects up to the T6 vertebra, and also in case of cadavers at the level of T4. Sometimes a newborn goes to up to the level of T3 also. This is for the newborns. This is for cadaver, and this is for the living beings, for the living adults. This is the level. So trachea is in toto extending from C6 to the T6 vertebrae. That's how this is the extent of trachea. And in this extent, the length of the trachea is 10 to 15 centimeters long. So in this extent of C6 to T6 vertebra, the length of the trachea is 10 to 15 centimeters long. And we also have something called as the internal diameter. So one thing is internal diameter, and we also have the external diameter. So the internal diameter of the trachea is, we say that it is 3 mm. So 3 mm is the internal diameter when you are a newborn. But with age, with years, it is going to increase by 1 mm. So 1 mm increase per year. And maximum of this internal diameter is 12 mm. So 12 mm is the maximum limit of the internal diameter. Then we have the external diameter. I told you there are two diameters. Now this is the external diameter, and the external diameter in case of males, it is 20 centimeters. Now note it, this is in millimeter and this is in centimeter, while in case of females, it is 15 centimeters. So this is some of the basic measurements. Now this diagram that I have drawn for the trachea, it's a complete diagram for understanding the relations, for understanding the blood supply, for understanding the various other topics we will study. This is a complete diagram, and you can just draw this diagram in the exam. Okay, so I'll explain you this entire diagram when we do the relations of the trachea. So here, now we'll start with the relations. Now this is the trachea, and this is the arch of aorta. So the arch, now this is the arch of aorta. And the arch of aorta, you know, this one is the brachiocephalic trunk. So this thing is, this is the brachiocephalic trunk. This is the common carotid, and this one is the subclavian. This is the subclavian, or we can say left subclavian. It's on the left side. So this is the left subclavian. And here we have the brachiocephalic. So there are two brachiocephalics, the right brachiocephalic and the left brachiocephalic, forming the superior vena cava. Now this brachiocephalic vein is formed with the union of subclavian and the internal jugular vein. So you can write down that this is left brachiocephalic vein, which is formed by the union of left internal jugular and left subclavian. This is right brachiocephalic vein formed by the union of right internal jugular and right subclavian. So these two unite together to form the right brachiocephalic vein, which together form the SVC at the lower border of the first costal cartilage. Okay. Now this is the brachiocephalic, this is common carotid, and this is the subclavian for the arch of aorta. Now we are starting the relations. Now relations में पहला हमारा आते हैं anterior relations. Now anteriorly present to the trachea, we can see the arch of aorta. So just see this diagram, just visualize this diagram, you will get to know. First of all, you have the arch of aorta. So you can write down that arch of aorta is present anteriorly along with the right brachiocephalic trunk. So this is arch is right, and next it's the brachiocephalic trunk, and also the left common carotid. Okay, not the subclavian. Subclavian is not here. Then you can have the SVC. So we can have somewhere or the other SVC as well. But very, very important you to remember is left. This is the left and this is brachiocephalic vein. Left brachiocephalic vein. So these are just relations for the interior. Now we'll talk about the posterior relations. Now posteriorly ये trachea है, इसके पीछे देख लो. You will find out esophagus. And you are gonna even see the left recurrent laryngeal nerve. So left recurrent laryngeal nerve. Now we are going on to the right side. Now this is the right side. अब right side में you know कि यहाँ पर SVC है, तो यहाँ पर कौन आएगा? Azygous vein, है ना? So यहाँ पर अगर SVC आती है तो we'll have the azygous vein here, and other than the azygous vein, we can see here, let's say the vagus, the right vagus, the right vagus nerve. Right vagus क्यों आएगी? Because if you have the esophagus से stomach बन रहा है, तो right and left vagus have to be there, right? Right vagus nerve is there. Then we can have the right lung and pleura. They're gonna be also there. Then if you talk about the left side, now in the left side we can again see that in the left you're gonna have the left lung and pleura. So left lung and pleurae. Then you can have the arch of aorta. So this is the arch of aorta present. Then other than the arch of aorta, you have this left subclavian, जो हमने anterior में नहीं लिखा था. So you can have the left subclavian as well. And also in the left side, you can have the left common carotid. So common carotid is here also. This is left common carotid. Okay. And remember, यहाँ पर हमने सिर्फ vagus लिखा था. यहाँ पर हमने सिर्फ vagus लिखा है on the right side. On the left side, you can have the vagus and the phrenic also. So you can mention it or you can even avoid it. So that is not a problem. But you can mention it, both the things, the vagus and the phrenic nerve. However, if you just see the diagram, this diagram is a complete diagram for telling you the relations present in the right. This again, on the right you can see the SVC. Then obviously since you can see the SVC, you can have to appreciate the azygous vein. Then you will have to appreciate the right lung and the pleurae, the right vagus. Here you can have the vagus, you can have the phrenic nerve, then the arch of aorta, common carotid, subclavian, right? Now we have the blood supply. So the blood supply, if you talk about the arterial supply, you have to talk about both the arterial and the venous drainage. So you have the arterial supply. Arterial supply is via the inferior thoracic arteries, inferior thyroid arteries. क्योंकि how can you learn this? Inferior thyroid arteries क्यों होंगे? क्योंकि यहाँ पर thyroid gland है, तो यहाँ पर inferior thyroid arteries आ जाएंगे. Then if you talk about the venous supply, so this is the venous, which is the left brachiocephalic vein. Left brachiocephalic vein will be also be there. Then in the lymphatics, you will have the pretracheal and the paratracheal lymph nodes. Pretracheal and paratracheal lymph nodes. Okay, so now we are moving on to the applied anatomy of this topic. Now, applied anatomy may we have a very important topic of the carina. So, what is the carina? Carina is a point of bifurcation of the trachea at the level of T4 or T6, where you have the formation of the right and left bronchial vessels, or the principal bronchi. Now, see, I'll write down, this is the trachea. Now, the trachea has to bifurcate, let's say at the level of T4. Okay, so this is the right principal bronchus. And this is the left principal bronchus. And you know, right, that the right principal bronchus, it is shorter and it is wider and it is more aligned to the trachea. As a result, the infections are more common to the right side than to the left side. So this is something as an extra information. But this point of the bifurcation, so this entire point, this is called as carina. Now this carina is a mucus sensitive area. It is a mucus sensitive area. That is the first point for the carina. Second point of the carina is it is at the level of the tracheal bifurcation. It is at the level of the tracheal bifurcation. That is the second point. And third point is it can be seen through the radiographs. So whenever you have the radiographs of the trachea, you can appreciate the carina. And the last important point is the distance. So we say it is 25 centimeters from the incisors. or 30 centimeters from the nostrils. So this is a very important question for your MCQ point of view. So I'm going to write down this question for your MCQ, for the NEET MCQ papers. Now we'll do some important MCQs. Okay, so let's see the question. Now here we have to select the incorrect with respect to the trachea. First is it extends from the lower border of C6 to the lower border of the T4. So we'll now go again to the diagram that we drew. So this is our diagram. It is extending from the lower border of the C6 to the T4. I told you the T4 isn't there in the cadavers. So this is acceptable. So we'll do the answer that this option is correct, and we have to find out the incorrect. It's a fibrous, it's a flexible fibrocartilaginous tube. Why cartilaginous tube? It's a cartilaginous tube because of the presence of C-shaped hyaline cartilage. Hyaline cartilage is there. So C-shaped hyaline cartilage is present in the trachea, and this is anteriorly present, and posteriorly we have the trachealis muscle. Okay, so it's a fibrous elastic tube also. And remember one more thing, that suppose this is the trachea. Okay, so this trachea, I told you that they are C-shaped cartilaginous rings, and now we have some cells as well. So this is the ciliated, so they are ciliated columnar epithelium present. Ciliated columnar epithelium along with the goblet cells. Plus we also have the goblet cells. Goblet cells are the mucus secreting cells. They are going to release mucus, and mucus is very important for the protective action of the trachea. Protection against pathogens or foreign bodies. So उनके against mucus release करते हैं, we are gonna expel them out from the body. So this is correct. Now external diameter in adult male is 2 centimeters. Now for the external diameter and the internal diameter, I told you that if we have the internal diameter as a maximum of 12 mm, and the external diameter in case of males is 20 centimeters and female is 15 centimeters. So this option is also correct. The external diameter in male is 20 centimeters. Sorry, it should be 20. It's not 2. It is 20 centimeters. It's a correct option. And the external diameter in the adult male is 15 mm. So this is wrong because it has to be 12 or 13 mm for the maximum, or up to 12 mm actually. So it has to be, this has to be the maximum level. Okay, so this is your answer. Moving to the next MCQ. Anteriorly, trachea is related to all of the following except. So now this is trachea. Anteriorly, you can see what are the structures present. Again with this diagram only, we will find out our answer. First is arch of aorta and the left brachiocephalic vein. I'll show you both of them. Anteriorly only, this is the arch of aorta and this is the left brachiocephalic vein. So both of them are present anteriorly. Next is esophagus and the deep cardiac plexus. So we have esophagus present posteriorly. Esophagus with the left recurrent laryngeal nerves, these are present posteriorly. So this is wrong statement. And deep cardiac plexus are present because the heart is in relation. So as a result, we'll have the answer to be the esophagus. This is not present anteriorly. All are true for the trachea except it begins at the neck of lower border of the cricoid cartilage. Now this is the cricoid cartilage. So it's going to begin at the lower border of the cricoid cartilage. So this is correct statement. Then it is 20 centimeters long. I told you that it is 10 to 15 centimeters long. So this is the width. So this one statement is wrong. Okay, but we'll see other as well. It is made up of 16 to 20 C-shaped hyaline cartilaginous rings. So yes, it is made up of these rings. So it is also correct option. And it terminates at the sternal angle. Where is the sternal angle? Sternal angle at the level of T4. And I told you that T4 or T6 level is correct for the cadavers. So this option is also correct. So this is your correct answer. This is wrong statement. It should be 10 to 15 centimeters long. Maximum 15. Now this is a PBQ related case study. A wrestler's chest is compressed due to a match causing posterior displacement of clavicle at the sternoclavicular joint. Which structure is at risk? So we'll see the options and we'll try to eliminate the options for this question. First is aorta. Now if you see the sternoclavicular joint now, sternoclavicular joint will be ahead. It's not clear from this diagram, but you can definitely understand that if we have the bifurcation of the trachea at this level, so yahan par we'll have the sternal angle. Okay, so here you will have 5 centimeters long. You will have the manubrium sterni. Somewhere here you have the manubrium sterni. So definitely arch of aorta is below it, and arch of aorta is just extending little bit above the sternal angle. So this cannot go up to a good level of the sternal angle, or up to 5 centimeters above the sternal angle, right? Because 5 centimeters above the sternal angle, we have a we can only have the manubrious sterni for the attachment of the clavicle and the formation of sternoclavicular joint. So arch of aorta is not an option. In fact, any other aorta is also not an option. Arch of aorta is going to be that at a very high level, no? Next, we have esophagus. Esophagus is present posteriorly. So considering it is present posteriorly, it will not be affected. Trachea is present anteriorly, and trachea is present in the midline. So this can be the answer. But if you see the SVC now, SVC also, it is going to begin at the lower border of first costal cartilage. So it's beginning at this level. It is below the sternoclavicular joint. It is actually below the sternoclavicular joint. So because of this, SVC should not be your answer, and hence the trachea will be your answer. So that was all for the class. Thank you so much for watching. Do subscribe, share my channel.